Hello everyone, this is Brenda, owner of Zackel & Associates Legal Nurse Consultants. In my last video, I spoke briefly about supine positioning and its physiological effects, best practices, and special considerations. Today you will learn those details regarding prone positioning. Pressure injury development is a frequent complication of the prone position. With increased risk areas, vulnerable patients need surveillance and active prevention. Patients may be placed in the prone position for procedures that involve the posterior aspect of the head, neck, thoracic and lumbar spine, heel, or leg. Plastic surgery involving posterior structures or rectal surgery may also require prone positioning. The prone position places extra pressure on the chest, abdomen, and face, such as the chin, forehead, and ears. There's also an increased intraocular and intra-abdominal pressure. Cardiovascular changes such as hypovolemia or low blood volume, venous air embolism, and respiratory changes can also occur. The use of prophylactic dressings such as a Mepilex border applied to high-risk pressure points help to reduce the effects of pressure, friction, and shear on these areas. For spinal procedures, when a spinal table such as a Jackson prone table is used, use caution when placing the patient on the padded chest, hip, and thigh rest. The patient must be lifted and placed on the pads, not pulled. This will help avoid tissue shearing and tearing. Ensure that the metal bed frame is padded and that none of the patient's skin is directly touching the frame. Best practices for prone positioning include maintaining the head and neck in a neutral position without excessive flexion, extension, or rotation. Use face positioners to protect the patient's forehead, eyes, and chin. These positioners, commonly known as prone pillows or prone views, allow the head to remain in a midline position and provide a path for airway maintenance and a clear view of the patient's face. The anesthesia professional should check the patient's eyes and assess the patient's airway frequently throughout the procedure and during all positioning changes. These checks and results should be documented. When using a Wilson frame or gel rolls, the two chest supports should extend from the clavicle to the iliac crest. These supports allow full lung and abdominal expansion. Patients should be in the prone position for the shortest amount of time possible. A stretcher must be readily accessible during surgery to reposition the patient to supine position in the event an airway emergency occurs. Did your client develop a positioning injury because the healthcare providers failed to appropriately position and assess them? Did their significant deviations result in a preventable injury such as a pressure ulcer? Let our experienced team at Zackel & Associates help you further develop the case. This is Brenda Zackel, bridging the connection between medicine and law.